Good morning and welcome to Inside South Florida. I'm Dave Azer. Today, do you know what platelet-rich plasma is? Well, if you have an injury, it might help you heal quicker. We'll tell you all about it. Plus, you'll meet two local South Floridians looking to unite the global yoga community. And you'll learn about a local organization that helps to save abandoned dogs. All that and more as Inside South Florida starts right now. Whether you're an avid athlete, a weekend warrior, or you're just feeling some bumps and bruises, platelet-rich plasma may be just what you need. And here's orthopedic surgeon Dr. Jonathan Hersch to tell you all about what it is. Dr. Hersch, great to have you on the show. Welcome.
Great, thanks for having me.
This is going to be really exciting because I think this is such a cool, interesting, innovative topic, and I can't wait to talk to you about it. So let's go. PRP injections, what are they? What do they do?
PRP stands for platelet-rich plasma. So basically the concept is taking your blood and taking the proteins from platelets, which are small little molecules in our bloodstream, injecting it into various parts of the body to try to enhance body tissue and allow things to heal.
Give me a practical example. You know, why would someone need it? How does it work, kind of thing?
It sort of first came into the orthopedic realm with probably tennis elbow is the most common procedure that we'll use it for. That's an overuse phenomenon where tendons of the elbow start to tear or degenerate. So if you inject these proteins from the blood directly into that tendon, you can get some regeneration, regrowth of tendon, and complete healing of the problem.
It's incredible. Is this a fairly new technology? How long have people been doing this?
For orthopedics, I'd say a couple of years. In medicine in general, many more than that. Plastic surgeons, oral surgeons have been using it way longer than orthopedics, and we're starting to figure out what disease processes we could use it for.
Is this controversial at all? Are there any objections that people have raised about it?
There's no safety issues. The objections sometimes have been cost, and the type of PRP you use is still up for grabs. There's many companies helping us use this. How much platelets to use and things like that is more of the controversy. So the science behind it is still being figured out.
So let's say someone comes in with tennis elbow, right? Where do you take the blood from? Does it matter what part of the body? How do you determine that?
As if you were giving blood for labs. You just draw the blood from a vein, and there's a process where you spin it in the office and basically take the plasma from the blood and inject it to the site.
So it's pretty quick?
Very quick. Probably the whole thing takes about 15-20 minutes.
And you're awake. It's not like a major surgery or anything.
You're awake. We usually use a little topical antiseptic, and we use a little anesthetic, but you're wide awake.
And then, so what happens from there? I go home, and the next day I feel great. How long does it take? What is it guaranteed?
Certainly not guaranteed.
Right.
We have failures. I'd say for tennis elbow, if you look in the literature, you're looking at probably 80 to 85% success. And that's pretty actually good for a problem that's can be very unsolvable in some people. As far as effect, it's not immediate. Sometimes it takes 6, 8, sometimes weeks or 3 months. So it's a process that's involved.
Is there any sort of conversation about this being a performance-enhancing drug, maybe something that wouldn't be allowed in sports, anything like that?
At this point, there's been no issues with that. It's nothing that's enhancing you beyond your own body's ability to heal. It's just trying to make you heal a little bit faster. It doesn't make what's healing any stronger necessarily than it would have been. So to my knowledge, there has been no issues with any organization about banning this problem.
And this is completely different than blood doping, that what Lance Armstrong got.
Absolutely, absolutely.
Yeah.
It's just a local injection into a tendon or to a joint.
Okay, so as we mentioned, orthopedic surgeons. So obviously South Florida is home to all kinds of athletes doing all kinds of things, everything from tennis to yoga to basketball. So let's segue from sort of treatment to prevention, okay? So for our viewers watching, give us some tips people should be aware of when they're exercising that'll potentially keep them out of the doctor's office.
Most of what we see as orthopedic surgeons are too much of something, overuse. So every sport, you mentioned tennis, CrossFit comes to mind. They're sort of popping up all over the place. All of these are great things that we encourage our patients to get involved with, but starting out slow, learning technique, and people feel like they could necessarily go out without instruction. So something as simple as working out, playing tennis, even yoga, you can get injured if you're not really knowing what to do.
Right. You know, CrossFit, I think, gets a bit of a bad rap because you read all these articles about these people that get seriously hurt. So when someone is starting a new workout regimen, you know, they want to go 100 miles per hour oftentimes, You got to work into it though, right? You got to take care of yourself. How important is stretching, for example? Is that a big deal?
Well, certainly I think that's where yoga really helps, and I've incorporated that into my workouts, that yoga, something like that, where stretching, working on flexibility, and you even see professional athletes doing dance, yoga, tai chi, Pilates, all of these things were a more instructional way of stretching. We know that people get tight. You stop working out, you get in the car, you go home, and don't stretch. So it's usually the stretching we want you to do is after the exercise. You've gotten your muscles on fire, let's say in playing half an hour, 45 minutes of basketball, that's when you should be stretching and work on your flexibility.
It's interesting because you almost never see anyone after a pickup game of basketball stretching at the end, right?
Correct. Most people go out and get in the car and go immediately home. They're usually stretching before because they just got out of bed, they're tired, they're stiff, but the best time to stretch is when you're done.
You know, you just mentioned get out of bed. Do you think it matters if people work out in the morning, at night? Is there a better time to work out?
It depends what you're working out for. If you're trying to build muscle, it's actually the morning time is the better time to work out. If you're doing aerobic conditioning, things like that, it may not matter as much. But if you're a bodybuilder looking to build muscle, the morning's actually better.
Okay, so just a couple of minutes left. Let me ask you about kids, because obviously a lot of our viewers are parents and they've got kids playing sports. Same thing with kids? Kids should stretch? Kids should do as much preventative care as adults should?
Absolutely, and it used to be sort of thought that kids very young shouldn't be doing strength training. They shouldn't be lifting weights. They're going to damage their growth plates. And in moderation, I don't believe that's been proven. Same thing with techniques. Same thing with learning how to play a sport. Instruction is important. And our kids who are 12 get very similar injuries to our adults. And it's totally can be preventable. And the one thing in Florida is that days off and time off are difficult. Tennis is 365 days a year. Baseball, all the sports down here never end. And trying to pick that quote-unquote off-season for our children is very important.
Yeah, and I was a pitcher when I was a kid, and I remember they said no curveballs until you were 14, 15 years old or whatever. That's a lot of stress on a kid's arm, right?
Absolutely, and I think pitch counts and Little League Baseball is getting much, much better at enforcing things like pitch count for pitchers, and there are really age times when it is appropriate not to throw curveballs and things like that.
I feel like I could talk to you for a half hour. Unfortunately, we can't, so we got to go. But before we do that, how can people get more information about you, PRP, contact you? What's the best way?
Sure. My website is www.herschmd.com. That's HERSCHMD.com. And my office number is 561-417-3339.
Okay, well, it was great to talk to you, Dr. Hersch.
Great. Thank you.
Enjoy your summer.
Thank you very much.
Thank you, Dr. Hersch. When we come back, two South Florida ladies have created an organization that helps you find a yoga class and a yoga teacher no matter where you are around the world. Stick around.